We have exciting new data in myeloma during this European Hematology Association Congress in Amsterdam. If we focus first on newly diagnosed myeloma patients, we will have the opportunity to see new data coming from daratumumab, the monoclonal antibody targeting CD38 that will be added to a standard of care we use in newly diagnosed myeloma patient transplant eligible, VTD, bortezomib, thalidomide, and dexamethasone. And this combination is going to be evaluated in a phase 3 randomized study. And the phase 3 randomized study basically will compare the VTD plus daratumumab as part of the induction, followed by transplant and consolidation with VTD plus daratumumab versus VTD transplant and VTD without daratumumab. The results are positive. The primary endpoint is stringent complete response, but I think that the take-home message is the benefit in progression-free survival with a hazard ratio of 0.43, indicating that maybe we are in front of a new standard of care for newly diagnosed myeloma patients transplant eligible. In this setting, I think that the Italian myeloma group will present an update also of an interesting trial in which the second generation proteasome inhibitor carfilzomib is being evaluated in combination with lenalidomide and dexamethasone, followed or not by autologous stem cell transplantation. This is the FORTE study, and Francesca Gai will compare KRD transplant KRD versus KRD without autologous stem cell transplantation. She will give, I think, important messages because although the follow-up is short and we are not going to see any data about progression-free survival, I think that it's interesting to see how maybe the transplant will have a significant role in patients with advanced stage of the disease or high-risk cytogenetic abnormalities, whilst maybe in the near future we can potentially put a question mark for the transplant in the upfront setting in patients at standard risk, in patients with ISS1. So I think that this is going to be also interesting. Another abstract that I would like to highlight is curative option for asymptomatic myeloma patients. And in line with the combination that Francesca Gai will present, KRD, the Spanish myeloma group has evaluated the KRD transplant, KRD consolidation and maintenance in a series of 90 high-risk smoldering myeloma patients. The results are encouraging, with a minimal residual disease negative rate after autologous stem cell transplantation over 50%, with excellent data in terms of PFS and overall survival. The follow-up is short, and of course we have to wait to have a longer follow-up, but I would say that the strategy seems to be very encouraging, especially because we are dealing with asymptomatic myeloma patients. In the relapse setting, I think that we are going to have also new combinations. Pomalidomide and dexamethasone is standard of care for relapse and refractory myeloma patients in third line and beyond. And during this European Congress, Professor Richardson from US will present the results of the phase 3 ICARIA study. PomDex versus PomDex plus isatuximab, another CD38 monoclonal antibody. The primary endpoint is PFS, and if we decided to add this monoclonal antibody to pomalidomide and dexamethasone, the PFS is going to be significantly longer, and the median PFS is of approximately 1 year. So again, we are going to be maybe in front of a new standard of care for this population. Finally, I would like also to mention the role of daratumumab, the CD38 monoclonal antibody, but used in a new formulation of subcutaneous administration. The COLUMBA study is a phase 3 non-inferiority randomized trial in which we will have the opportunity to demonstrate that DARA sub-Q is not inferior to DARA IV, but the main findings are that DARA sub-Q is administered at flat dose, 1800 milligrams, and in just 5 minutes. In addition, the safety profile in terms of reactions to the infusion is significantly lower in comparison with the DARA IV, and I think that one important finding is that a patient reported a more satisfaction when they receive the dara sub-Q versus dara IV. So I think that this presentation is relevant for the physicians, is relevant for the hospitals, but especially is relevant for the patient care. And finally, let me just to comment, well, new drugs, new cell modes. Iberdomide is a new immunomodulatory drug that will be evaluated in relapse and refractory myeloma patients, late advanced stage of the disease, but again, promising efficacy and safety results.